I'm Marie Eldridge. I've been a phlebotomist within the NHS service for over 13 years, working for many different NHS trusts and in different healthcare settings, such as hospital wards, outpatients, GPs and patients' homes. I started my career as a trainee phlebotomist. Once I was deemed competent and had some experience behind me, I then specialised in paediatrics, bleeding children from newborn up to 16, 18 years old with special needs. After specialising in paediatrics, I then went on with my career to become a trainer. After that, I went on to become and got promoted to a manager within the NHS to run a whole phlebotomy service. With this skill set and experience behind me, it gives me the opportunity to help you with your home learning and introduce you to the course of phlebotomy. Bringing my expertise to this training course, I hope you enjoy your learning experience alongside me. Introduction to phlebotomy. During the course you will be acquainting yourself with phlebotomy anatomy and the equipment, as well as partaking in the practical side of venipuncture. We will cover all aspects of phlebotomy, such as establishing a good understanding of the role, as well as exploring what characteristics a good phlebotomist should hold whilst considering best practice guidelines. During this course, we will be doing a live demonstration of venipuncture. At the end of this programme, you will partake in a multiple choice knowledge-based assessment. If successfully completed, you will be issued with a certificate of theory knowledge on the induction of phlebotomy. After successfully completing the knowledge-based theory test, you are welcome to join us for our phlebotomy competencies in venipuncture. These are not mandatory, but if decided to be undertaken, these will be done by the learner at home, using a prosthetic arm which can be purchased separately. The home learner will practice the art of venipuncture on a prosthetic arm and then submit footage to be assessed. On completion and deemed competent, the home learner will be able to put on their CV that they have the theory knowledge base and they have completed and passed competencies of venipuncture with anaesthetic arm. The home learner will be able to add to their CV that they have the knowledge base and also the competencies of successfully obtaining a blood sample from a prosthetic arm only, not a human arm. The competencies that you will leave us with and the programme allows you to only bleed from the prosthetic arm. Practice and practice makes perfect, but until you have been deemed competent by a NHS health professional, you are unable to bleed from a human person. Working through the course syllabus, we will start with the phlebotomist role, the day-to-day life of a phlebotomist and what is expected. Basic arm anatomy, we'll take a look at the difference between the veins and the arteries. We will familiarise ourselves next with the equipment. Phlebotomy equipment, the different ranges of needles, holders and vacutainers. Order of draw will come next, which is a very important part to which samples are taken and into which order. Consent of the patient, what is acceptable consent. And during the obtaining of a blood sample, we will be doing a live demonstration of venipuncture, how to do it correctly and how things can go wrong. Sharps injuries, very important part, how to report it, how to treat it. Infection control, we'll look at the phlebotomist's responsibility within the infection control guidelines. Common risks within phlebotomy, such as bruising, fainting. After we've completed these segments, we will go on to a multiple choice theory quiz.